Research shows between 20 and 30% of adults experience some form of acid reflux symptoms every week, and as many as 10% may have heartburn every day. But even though these symptoms are common, doctors say they should not be ignored. Gastroenterologist Dr. Avantika Mishra from Florida Digestive Health Specialists is here to explain how common heartburn can lead to a potentially deadly disease. Thank you, doctor, for joining us via Skype.
Hi there. Thanks for having me.
Certainly an important topic for sure. I know that many of us are familiar with heartburn, unfortunately, but might not be so familiar with some of the more serious conditions. So what is the disease that you are referring to?
Sure. So Barrett's esophagus refers to a precancerous condition in the esophagus. And essentially what it is when healthy cells get replaced with atypical cells due to chronic exposures, and ultimately that change can be concerning or also a prefactor for developing cancer in the future.
So how is this condition related to heartburn?
Sure. So, many people have chronic heartburn, which is typical burning in the chest, sometimes a burning in the back of the throat, chronic cough. And essentially what happens is the acid that's in the stomach can essentially beeline to the very end of the esophagus, where they have continued exposure of acid reflux to those cells that are hitting the end of the esophagus. And ultimately, when that happens over a period of months and actually many, many years, that is what predisposes you to developing Barrett's esophagus. So many people can have chronic heartburn, but ultimately chronic exposure due to acid reflux is what predisposes you to Barrett's esophagus.
And I understand that this is more common in men. What age range?
Yeah, so typically in men over the age of 50 are considered a risk factor for Barrett's esophagus. But there are also a multitude of other risk factors that predispose patients to developing this. So one is chronic reflux, as we mentioned, and that refers to those typical heartburn symptoms that we discussed, but also patients who have a history of smoking, patients who have obesity, and there's certain also race and, as we talked about, gender predispositions that can also lead to this.
So I would imagine that, like many conditions, it's the importance of screening and identifying and diagnosing early is typically helpful. What are some of the symptoms other than heartburn that might be common that we might look for?
Sure. So heartburn specifically refers to that burning sensation in the chest, but there can also be silent versions of that. People can have chronic cough, there could be nausea, there could be association of difficulty swallowing, unexplained abdominal pain. Now, it's important to understand that Barrett's esophagus in and of itself doesn't cause symptoms, but it's some of these other factors related to reflux that are what trigger our identification that someone may be at risk for developing.
Okay, now I think we all know people in our lives that have, the bottle of antacids in their desk drawer or are constantly popping Tums or things like that. What is, when we look at the data, what is the frequency of cancer as a result of if you do have Barrett's esophagus?
Sure. So up to 10 to 15% of patients who have chronic heartburn are predisposed to developing Barrett's esophagus. So that's an extremely high number. That being said, chronic reflux can still be managed with routine over-the-counter medications and prescription medications. But when we see you in the office, we kind of assess all these risk factors as a whole and determine if you're someone who merits screening with an upper endoscopy.
So that actually leads me into my next question, which is, what is the treatment? If we did, want to get checked out, maybe we have some of these symptoms, what would that look like for us?
Yeah, so primary management is usually high-dose acid reflux medication. In addition to when you get an endoscopy done, we look at the physical lining of the esophagus, the stomach, and we try to identify how long your segment of Barrett's is. Is there anything suspicious like a nodule or a mass in that area? And so it's a combination of not only prescription medication, but also surveillance through routine endoscopies, which we as gastroenterologists perform.
Thank you so much, doctor. Great information for sure. If you would like to get more information on Barrett's esophagus, you can find Florida Digestive Health Specialists on their website, fdhs.com. We'll be right back.